Silk Route, Improving Outcomes with a New Refractive Procedure. And she'll be talking again on Smart Side, the clinical experience and wound healing perspectives. Dr. Pooja is from Bangalore. She is a surgeon and a translational researcher who works span refractive surgery, keratoconus management, ocular surface diseases. And she's presented various papers across the world. And over to you, Dr. Pooja.
Thank you, ma'am. Thank you, Dr. Kala, for inviting me here and giving me the opportunity to share our experience on lenticle procedures. So this is a topic my colleague and a senior Rushad was supposed to cover, but he couldn't make it because of family emergency, so I'll just be sharing my perspective. So we are all talking here about all the lenticle platforms, Smile, Clear, the silk, and then the smart side. So one thing always everybody keeps asking me, what is my favorite machine, or if I have to buy one, what would you choose? So just to begin with, comparison is the thief of joy. Always remember that whatever works the best in your hands is what you should probably go for. Whatever you feel the comfort with a particular machine is one which you could go for, because we saw the presentation on Smile and then we saw it on Clear. Everything works good, but it has to be like what works good in your hands, what works good in your city, your patient profile. So you have to look at multiple aspects before you choose a machine, because every technology is good, every technology has its own uniqueness, but sometimes Clear may work good for my patients in my setup, my country, or my city, and maybe Smile may not work. So you just have to choose accordingly. So when it comes to silk, it does have a different lenticle profile. So now again, everybody is like, when the Smile was launched, it was a plano convex shaped lenticule, and it did have an edge over the preservation of nerves and a smaller side cut. But here it's a biconvex shaped lenticule with a side cut, and if you see the spot size, the energies and everything, the energies here are as low as 45 nanojoules. You can, based on your machine, you can go to 30 nanojoules also. But the second beautiful, most important part here is the spots are next to each other. The spots, if you can see, there's hardly any space. They're as small as 1 micron, and the spacing between the spots is also 1 micron. Compared to the conventional lasers, where the spot to spot distance can range anything from 2 to 4 to 7 microns. So here, that's the beauty of Elita silk laser. Because of that, it's technically a separated lenticule, so you don't need to like worry a lot on dissection, or you don't need to struggle a lot on dissection. How Dr. Sanjeev showed, to open the anterior posterior plane, you don't need to do any wiper movements. Just from left side to right side, one swipe on the anterior and posterior plane can help us to remove the lenticule, and that's how the 1 micron spot spacing and the 1 micron spots help. And because you're not doing too much of pressure on dissection of lenticule, the recovery in terms of the quality of vision is much faster compared to other platforms. And because of this, what you can do is, it's like something like a Rexis in your flax platform. You can just hold your lenticule and do something like a Rexis, where you can do a circumferential tangential movement from 12 o'clock to 6 o'clock, and that's how you can remove the lenticule. So here also, you just identify the anterior posterior planes, take your 23 gauge forceps, and just like how you do a Rexis in your cataract procedure, you can do something like that and remove the lenticule. It works in 70 to 80% of the cases in beginner's hand, but again, always learn the traditional dissection and then go to this one of these techniques. And because whenever a peel procedure, like in a very small myop or something, it's not possible, dissection always is the thing which you could provide for. And now, because of with further optimization of the energies, you do not even need to do something like a Rexis. You can just identify the planes, push the lenticule and pull it. So that's how this is the advantage of the spot spacing with the silk laser. And again, because you are minimally dissecting it, or there is no tissue bridges present here, there is a very smooth dissection, and that's how the quality of vision on day one is little better compared to that of other platforms. And this is some work we have done in terms of quality of vision, the retroillumination, the day one post-op, and the Bowman's membrane. So the second thing which I said is about the shape of the lenticule, and the shape of the lenticule is a biconvex. And because it's a biconvex shaped lenticule, probably it's preserving the peripheral nerves compared to that of smile as well, and that's when the recovery of nerves is little faster, and it also helps in many other ways. So this is how the two lenticule profiles look like: the plano-convex, which is the traditional, and the biconvex shaped lenticule in a real time patient. And these are just the OCT images on how the lenticule shapes are intraoperatively for these patients. The quality of vision, 96% of the patients do achieve 20/20 uncorrected distance visual acuity at 1 week, and 4% do come back to 20/20 within a month. But the problem, the question here is, now do we just look at 20/20, the quantity of vision, or should we look at something more? Because every time we get a question, my LASIK patients are having a very good quality of vision, but my lenticule patients are not happy. So is it just the fault of a technique or something else? Probably the role, the shape of the lenticule could have a role in this, and we did some work on the aberrations, and these findings were supported by Rushad's work as well, where there was minimal change compared to whatever your pre-op aberrations were. There was minimal induction of higher order aberration post-operatively, especially the comas and the spherical aberration. And whenever you preserve the spherical aberration, you probably are preserving the depth of the focus for the patients, and that's how they have a good depth of focus for distance, intermediate, near, and this helps a lot for the pre-presbyopic patients as well. So we did, again, next thing, because it was preserving the spherical aberration, and we wanted to see whether it helps in the pre-presbyopic age groups, and this is a study which is done between the patients of 38 years to 45 years who are undergoing silk, and we could see that they could read as well. A lot of times when you operate a patient of 38, 39 or 40, they're not very happy post-operatively with the quality of vision. They say that I have a lot more issues in focusing. So we compared the presbyopic healthy patients with the silk patients, and we could see that they are not losing that quality of vision or the depth of focus post-operatively in after silk procedure compared to that of what a healthy patient would look like. So because you're maintaining the spherical aberration, it's also maintaining your depth of focus, which is something like an EDOF kind of an effect, what you would see with EDOF lenses. And this was also supported by the curvatural changes, because of the shape of the lenticule, there was lesser change in SA and sphericity. And if you see the gradients from center to periphery, the gradient shift in a biconvex shaped lenticule was much lesser compared to that of a plano-convex lenticule. And also because the peripheral nerves are preserved, the regeneration is much faster here, and it also helps in epithelial remodeling much better in silk compared to that of a plano-convex shaped lenticule, which is the traditional laser. So this is just the beauty of the biconvex shaped lenticule, and this is some data of contralateral eye study of epithelium between plano-convex and biconvex, suggesting that the epithelial remodeling is much better or controlled here. So yes, silk does give us an advantage. It's a low energy laser. The spot sizing and distance is much more adequate because the spots are next to each other. It's technically a separated lenticule, so it's a very easy dissection, and it also helps in nerve regeneration also. So the quality of vision here is little better sometimes post operatively. Thank you.